call the member for Hunter.
Thank you, Deputy Speaker, and thank you to my mate, the member for Hawke, in bringing this motion forward. Healthcare should be accessible to everyone, regardless of their income. But the sad reality is that too often people find it too hard to find a doctor which bulk bills. This means that people are choosing between paying to see a doctor and covering other essential costs. We know that when we are unwell, we want to see a doctor as soon as we possibly can. But too often, people are finding it hard to get into their GP. This means that people are left to suffer while waiting days before getting a medical opinion. I strongly believe in two things when it comes to healthcare. When you need help, you should be able to get it. And your Medicare should be your ticket to high-quality, world-class healthcare, not your credit card. That should be just part of the privilege of being an Australian. And once upon a time, this was the case. But somewhere along the way, we lost our way and became a country where healthcare is more accessible and more affordable for some than it is for others. This is wrong. Someone earning a healthy wage is more deserving of a quality healthcare quickly available to them than someone who is struggling to put food on their table. That's why I'm proud to be a member of this government, which actually is strengthening Medicare, not cutting it. This government is delivering 58 Medicare urgent care clinics. These clinics are so important. When you go to the emergency department at the hospital, you're having a bad day. Too often, someone's bad day is made even worse by having to wait hours to be seen by a doctor. This is because our emergency departments are under too much pressure, but the 58 Medicare urgent care clinics will play a major role in taking away some of this pressure. These clinics are a way to make it easier for Australian families to be able to see a doctor when they need it. Some things are urgent, but not life-threatening. But sometimes the only option is to go to the emergency department, especially when it can take days to get into a GP. This adds to the pressure facing our hospitals. Having a Medicare urgent care clinic near you means that if you need medical attention urgently, but are not in a position which is life-threatening, you won't be stuck in an emergency room waiting for hours and hours, and you won't be left hanging, waiting for the next available appointment by your GP. Deputy Speaker, not only will these clinics relieve the pressure on emergency departments, but they will also bulk bill. All you need when attending one of these clinics is your Medicare card. Regardless of your financial situation, you'll have the care available to you when you need it. This is the way it should be. And Deputy Speaker, my electorate is lucky enough to be receiving one of these new Medicare urgent care clinics in Cessnock. I'm excited to say that this clinic is scheduled to be opened next month. It was an honour to have the Prime Minister come to my electorate during the federal election campaign and announce that Cessnock would be receiving one of these clinics. I know from speaking to people around Cessnock that this clinic will be well received and will definitely be used by many who need it. And Speaker, Cessnock is a perfect case study for why these clinics are so desperately needed. Cessnock is rapidly growing, with the population edging over 60,000, but the hospital has not kept up with the population growth. This is not a reflection on the staff. They are all amazing and do a great job. And to them I say, thank you for the hard work that you all put in and the hours and the efforts that you do to keep us all safe and well. But the emergency department is just under too much pressure. Making matters worse, there are limited GPs which do have bulk billing available, and the one which do are under lots and lots of pressure right now as well. The urgent care clinic will mean that Cessnock's growing population will not have to wait hours in the emergency room at the Cessnock Hospital or be forced to make the half-an-hour drive to Maitland Hospital to be seen by a doctor. My electorate and the community of Cessnock needs this clinic, and I want to thank the Prime Minister and the Minister for Health for looking out for the health of the people in the Hunter. Thank you.